There's a conversation that almost never happens. Not at the gym, not at the doctor's office, not even between close friends. It's about something every man owns, uses every single day, but rarely thinks about maintaining. I'm talking about your penis. And before you click away thinking this is awkward or unnecessary, let me ask you something. Do you brush your teeth every day? Do you check your car's oil? Do you maintain your phone? Of course you do. But when was the last time you thought about the proper care and maintenance of one of the most important parts of your body? The truth is, most men walk through life completely ignorant of basic penis care until something goes wrong. Until there's pain. Until there's dysfunction. Until a relationship suffers. And by then, the damage might already be done. What's even more shocking is that many of these problems are completely preventable. They're the result of simple mistakes, old myths, and misinformation that gets passed down from generation to generation. Today, I'm going to break the silence. I'm going to share with you 5 essential care tips that every man needs to know, whether you're 20 or 70 years old. These aren't just suggestions. These are fundamentals backed by urological science that can dramatically impact your sexual health, your confidence, and your overall quality of life. If you care about maintaining your performance, preventing disease, and keeping everything working properly for decades to come, then you need to watch this entire video. Let's dive in. Let's start with the absolute foundation, hygiene. Now, I know what you're thinking. Of course I wash myself. This is basic, but here's the shocking reality. The majority of men are doing it wrong, and that mistake is leading to infections, inflammation, and even contributing to more serious health problems down the line. The mistakes men make. First, let's talk about what not to do. Many men use harsh soaps, body washes with strong fragrances, or even shampoo on their genital area. The skin on your penis, especially around the head and under the foreskin, is incredibly delicate. It's mucous membrane tissue, similar to the inside of your mouth. When you use harsh alkaline soaps, you're stripping away the natural protective oils and disrupting the healthy bacterial balance. This can lead to dryness, irritation, and increased susceptibility to infections. The right way to clean. Here's the proper protocol. Every single day, during your shower, use only lukewarm water and a gentle, fragrance-free cleanser, or better yet, just warm water. If you're uncircumcised, this next part is absolutely critical. You need to gently retract the foreskin and clean underneath it. This is where a substance called smegma accumulates. Smegma is a combination of dead skin cells, oils, and moisture. It's natural, but if it builds up, it creates the perfect breeding ground for bacteria and can lead to balanitis, which is inflammation of the head of the penis, or even more serious infections. After cleaning, and this is just as important, make sure to dry the area thoroughly. Moisture trapped under the foreskin or in the folds of skin creates a warm, damp environment where bacteria and yeast thrive. Pat dry gently with a clean towel. Don't rush this step. The underwear factor. Your choice of underwear matters more than you think. Tight synthetic fabrics trap heat and moisture. This creates what I call a bacterial incubator. Instead, opt for breathable cotton underwear or moisture-wicking athletic fabrics. And here's a tip that might surprise you. If you're at home, especially at night, consider going commando occasionally. Allowing air circulation helps keep everything dry and healthy. The warning signs you're ignoring. If you notice any persistent redness, unusual odor, itching, or discharge, don't ignore it. These are your body's warning signals. They could indicate anything from a simple hygiene issue to a fungal infection to a sexually transmitted infection. The earlier you address these, the easier they are to treat. Now let's talk about protection. And no, this isn't just a lecture about wearing condoms, although that's critically important. This is about understanding the real risks and how to protect yourself comprehensively. The STI reality, sexually transmitted infections, are far more common than most men realize. According to the latest data, millions of new cases occur every year, and many people don't even know they're infected. Chlamydia, gonorrhea, syphilis, herpes, HPV, and HIV are all very real threats. And here's what most men don't understand. Many sexually transmitted infections have no immediate symptoms. You can be infected, feel completely fine, and unknowingly pass it to your partners, while the infection slowly damages your body. Some infections, if left untreated, can lead to chronic pain, infertility, and even increase your risk of certain cancers. HPV, for instance, is linked to penile cancer and throat cancer. Untreated gonorrhea or chlamydia can cause epididymitis, a painful inflammation that can affect your fertility. The proper use of protection. Condoms are your first line of defense, but only if used correctly, and this is where many men fail. The condom needs to be put on before any genital contact, not just before ejaculation. Pre-ejaculate fluid can contain STI pathogens and even sperm. Make sure you're using the right size. A condom that's too tight can break, one that's too loose can slip off. Check the expiration date. Store them properly, never in your wallet where heat and friction can damage them. And use water-based or silicone-based lubricants, never oil-based products which can degrade latex. Regular testing is non-negotiable. If you're sexually active, especially with multiple partners or new partners, you should be getting tested regularly. At minimum, once a year. If you have multiple partners, every 3 to 6 months. This isn't about trust, this is about health. Many STIs can be present even in monogamous relationships if one partner was infected before the relationship began and didn't know it. The injury prevention factor. Here's something rarely discussed. Penile injuries are more common than you'd think. Aggressive sexual activity, certain positions, or even masturbation techniques can cause trauma. The most serious is penile fracture, which despite the name isn't actually a broken bone but a tear in the tunica albuginea, the tissue that allows erection. This is a medical emergency requiring immediate surgery. The lesson? Be mindful during sexual activity. If something hurts, stop. Pain is your body's warning system. This is where we get into something that affects every man as he ages, but most have no idea they can actually do something about it. I'm talking about maintaining your erectile function. And yes, the old saying, use it or lose it, has real scientific backing. The biology of erections. An erection is fundamentally a vascular event. It requires healthy blood flow. When you become aroused, blood rushes into the spongy chambers of the penis, called the corpora cavernosa. The tissue expands, and special valves trap the blood inside, creating rigidity. For this system to work properly, the blood vessels, nerves, and tissue all need to be healthy and functional. Why erections keep you healthy? Here's the fascinating part. Regular erections, whether from sex or masturbation, actually help maintain penile health. When blood flows into the penis, it brings oxygen and nutrients to the tissue. Without regular oxygenation, the smooth muscle tissue in the corpora cavernosa can begin to be replaced by collagen, essentially scar tissue. This process, called fibrosis, makes the tissue less elastic and can permanently impact your ability to achieve firm erections. Multiple studies have shown that men who have regular sexual activity or regular erections maintain better erectile function as they age. The mechanism is simple. It's exercise for your penis. Think of it like any other muscle or tissue in your body. If you don't use it, it atrophies. The morning erection indicator. Pay attention to your morning erections. Healthy men typically experience 3 to 5 erections during sleep associated with REM cycles. These are your body's natural maintenance system, ensuring regular blood flow to the penis. If you stop having morning erections or they become weak, this is often an early warning sign of cardiovascular problems, diabetes, low testosterone, or other health issues. Don't ignore this signal. Lifestyle factors that destroy erectile function. Several lifestyle factors directly damage your erectile capability. Smoking is one of the worst offenders. It damages blood vessels, reduces blood flow, and accelerates atherosclerosis. Excessive alcohol consumption impairs nerve function and reduces testosterone. Obesity increases the risk of diabetes and cardiovascular disease, both major causes of erectile dysfunction. Chronic stress elevates cortisol, which suppresses testosterone and sexual function. The good news? These are all modifiable. Regular exercise, especially cardiovascular exercise, dramatically improves erectile function by improving blood flow. A healthy diet rich in fruits, vegetables, whole grains, and healthy fats supports vascular health. Managing stress through meditation, adequate sleep, and healthy coping mechanisms protects your hormonal balance. When to seek help. If you're experiencing persistent erectile difficulties, don't wait. Don't be embarrassed. Erectile dysfunction is often an early warning sign of serious health problems like heart disease. In fact, ED can precede a heart attack by 3 to 5 years because the blood vessels in the penis are smaller and show damage earlier. A urologist can help identify the cause and provide solutions, whether that's addressing an underlying health condition, hormone therapy, medications, or other treatments. But before I continue with the next essential care tip, I need to share something critically important with you. While I'm giving you the essential care tips, there's a deeper issue that many men face. Recent research has identified what scientists are calling a hidden root cause of many male performance problems. If you're experiencing weak erections, reduced stamina, or declining sexual confidence, this could be the missing piece of the puzzle. There's a fascinating video presentation that reveals a simple, natural method based on cutting-edge science that addresses this root cause directly. It's not about pills or pumps. It's about targeting the real underlying issue that doctors rarely discuss. I strongly encourage you to watch it. Point your phone's camera at the QR code on your screen right now to open the video. I've also put a direct link as the top pinned comment below this video. Go ahead and open it in a new tab so you can watch it right after we finish here. Trust me, this information could be life-changing. Alright, now let's talk about something that almost no man knows about, but it's one of the most powerful tools you have for sexual health and performance. I'm talking about your pelvic floor muscles. You've heard women talk about Kegel exercises, right? Well, men have pelvic floor muscles too, and strengthening them can dramatically improve your sexual function, ejaculatory control, and even prevent urinary problems as you age. What is the pelvic floor? The pelvic floor is a group of muscles that stretch like a hammock from your pubic bone to your tailbone. The key muscle for sexual function is called the bulbocavernosus muscle, though you might also hear it called the PC muscle. This muscle does several critical things. It helps you achieve and maintain erections by restricting blood outflow. It powers ejaculation, and it controls urinary flow. Why most men have a weak pelvic floor? Modern sedentary lifestyles have left most men with weak, underactive pelvic floor muscles. We sit for hours every day. We don't engage these muscles regularly, and over time they weaken, just like any other muscle would. The result? Weaker erections, premature ejaculation, urinary dribbling, or incontinence, especially after age 50. How to strengthen your pelvic floor. The exercise is simple, but it requires consistency. First, you need to identify the right muscles. The next time you urinate, try to stop the flow midstream. The muscles you contract to do that are your pelvic floor muscles. That's the sensation you're looking for. But don't do the exercises while urinating. That's just to identify the muscles. Once you know what to contract, here's the routine. Contract those muscles and hold for 5 seconds. Release for 5 seconds. Repeat 10 times. Do this exercise 3 times per day. You can do it sitting, standing, or lying down. Nobody will know you're doing it. Over time, build up to holding for 10 seconds. The benefits you'll experience. Within weeks, most men notice improvements. Harder, more sustainable erections. Better control over ejaculation, which is especially important for men dealing with premature ejaculation. Stronger orgasms due to more powerful contractions. And as a bonus, better bladder control, which becomes increasingly important as you age. The final essential care tip might be the most important of all, because this is what catches serious problems early when they're most treatable. I'm talking about regular self-examination and getting proper medical checkups. Testicular self-examination. Once a month, you should examine your testicles. Testicular cancer, while relatively rare, most commonly affects men between ages 15 and 35. It's highly treatable if caught early, but many men don't discover it until it's advanced simply because they never check. Here's how. Do this after a warm shower when the scrotum is relaxed. Roll each testicle gently between your fingers. You're feeling for any lumps, changes in size, or irregularities. Testicles should feel smooth and slightly firm. If you notice any changes, see a doctor immediately. Penis self-examination. Look for any changes in the skin of your penis. New bumps, sores, discoloration, or lesions. Changes in the foreskin or difficulty retracting it. Any unusual discharge or bleeding. Persistent pain or changes in urination. These can all be signs of infection, STIs, or in rare cases, penile cancer. The prostate conversation. As you get older, especially after age 40, prostate health becomes increasingly important. Prostate cancer is one of the most common cancers in men. Regular checkups that include prostate screening, whether that's a PSA blood test or a digital rectal exam, can catch problems early. Talk to your doctor about when you should start screening based on your risk factors and family history. The bottom line on medical care. Don't wait until there's a problem to see a urologist. If you're sexually active, get regular STI screenings. If you're over 40, start having conversations about prostate health. If you notice any changes, any symptoms, any concerns, get them checked out immediately. Early detection is almost always the difference between a minor issue and a major health crisis. So let's recap these 5 essential care tips that every man needs to follow. Number 1, proper hygiene using gentle cleansers, thorough drying, and breathable underwear. Number 2, comprehensive protection through safe sex practices, regular testing, and injury prevention. Number 3, maintaining erectile function through regular use, healthy lifestyle choices, and addressing problems early. Number 4, strengthening your pelvic floor muscles for better performance and long-term health. And number 5, regular self-examination and medical checkups to catch problems early. These aren't complicated. They don't require expensive equipment or massive time investment. But together, they form a comprehensive approach to penile health that can protect you from infections, disease, dysfunction, and maintain your sexual confidence for decades to come. This is about taking responsibility for your own health. This is about not being the guy who ignores warning signs until it's too late. This is about understanding that proper care now prevents massive problems later. If this video opened your eyes to things you didn't know, I want you to do 2 things. First, hit that like button. It helps more men find this critical information. Second, subscribe to the channel, and hit the notification bell because we're going to continue having these important science-based conversations about men's health that nobody else wants to have. And remember that video presentation I mentioned earlier about the hidden root cause of male performance problems? Don't forget to check that out. The link is in the pinned comment below. That information, combined with what you learned today, gives you a complete picture of how to protect and optimize your sexual health. Now I want to hear from you. What was the most surprising thing you learned today? Did any of these tips challenge what you thought you knew? Drop a comment below. Let's keep this conversation going. Stay healthy, stay informed, and I'll see you in the next video.